Pain, we don't like to experience it, but we do know if you do have it, you can turn to Illinois Bone and Joint Institute for help. I spoke with interventional pain management physician Dr. Daniel Levin on how his team provides tools and resources for patients to get the treatment they need.
Pull back in. Okay. Arms up like this. Interventional pain management is a field where we utilize really a variety of modalities to treat patients with most often chronic pain, but at times also pain in more acute settings, with a focus to a certain degree on, as it sounds like, intervention, so procedures. We'll also use tools like physical therapy and medication management to kind of really formulate a more comprehensive treatment plan. Does this cause any pain? No.
When do you know it's time to go see a doctor about your pain?
It's always good when you're experiencing pain that's lasting, more than a few days to go and see your doctor. And you usually start with a primary care provider, urgent care provider. Should the pain persist and persist beyond what the primary care provider is comfortable treating, that's a good time to come and seek a little higher level of care. So you can see everything's well aligned here, maybe some disc space narrowing. It's the magnitude of pain, but also the duration, so how long it's lasting. If it's persisting for several days and is limiting your function, your sleep, ability to do what you need to do on a daily basis, that's an important time to go and see your doctor. Arms up like this and press out on me. As pain specialists, we treat a multitude of pain syndromes or presentations. The bread and butter is definitely neck and back pain, but we certainly treat all kinds of nerve type pain, joint pain like arthritis, as well as some other syndromes. The first step is generally to come to a diagnosis. So a patient comes in, we need to determine what the specific pain generator is or source of the pain is. If somebody's having some modest pain, but it's been persisting for several weeks, we might treat more conservatively with something like physical therapy, perhaps some anti-inflammatory medication, and see how they respond to that treatment over the course of several weeks. Whereas if someone is coming in more severe acute pain and need a more expedited relief, we may be a little more aggressive in choosing something like an injection. Here at Illinois Bone and Joint Institute, we have a fairly comprehensive approach because we have both non-procedural pain specialists and spine specialists, as well as people like myself who do interventional pain management, also the surgical side. So when we're no longer able to control their pain with more minimally invasive strategies, we have easy access to all of our fantastic surgeons. We can address all of that under one roof, which provides a really collaborative approach, which I think benefits patients.
Is there something that patients can do before their pain gets to be so extreme?
A healthy lifestyle is going to be beneficial. That means staying active, getting an appropriate amount of exercise throughout the week, healthy diet.
How do you monitor someone's progress?
After any sort of intervention, we'll have them come back for a follow-up visit and see them again. And we'll assess their response. So there's this subjective, did your pain get better? We also want to assess functional metrics. So are they able to walk longer distances? Are they able to participate in the activities that they need to? And kind of put together all those data points to determine how we're doing, where we're at, and if and what needs to be done further.
So the bottom line here is you really don't need to suffer.
If people are having pain, it behooves them to seek care with their doctors. We have a multitude of treatment modalities to prevent furthering of the problem and also get people some relief. Just gonna lift the leg up, good.
You heard it, you don't have to suffer. If you'd like more information about Illinois Bone and Joint Institute, visit IBJI.com.